chronic mercurial exposure, renal failure, primary hereditary band keratopathy, systemic hypercalcemia, or chronic ocular inflammation. I've added here 5 options rather than 4, so this is not a typical exam question. Just because we are studying, we are trying to learn more about each option. So, which do you think is the most common cause? Actually, the most common cause is chronic ocular inflammation, especially patients with GIA, juvenile idiopathic arthritis. So in your clinical exam, you might face a case with cataract or pseudophakic, young age in 20s or 30s, and maybe glaucoma like a valve, signs of chronic uveitis, and band keratopathy. So this patient, please don't forget to mention his GIA. Now let's study the other options. Chronic mercurial exposure. Does it cause calcific band keratopathy? Yes, it does. But it's not one of the most common causes. Why? Because mercury is used as a preservative in pilocarpine and contact lens solutions. So these are 2 reasons administering mercury direct to the eye. Fortunately, we have substituted the thimercel and the mercury-based preservative by benzalkonium chloride, which doesn't contain mercury. Renal failure, it causes imbalance between phosphate and the calcium and leads to deposition of calcium in the cornea. Primary hereditary band keratopathy, what is this? It's very rare, actually. It's rare to the extent that only 3 families described during the 20th century. Only 3 families. It causes deposition of calcium hydroxyapatite, the mineral salt of calcium phosphate, in the cornea. It has exactly the same pathology, but it's very rare. And systemic hypercalcemia, like metastatic calcification. But again, it's not very common. Just out of courtesy, I need to discuss with you the chronic mercury exposure and effect to the eye. As we just mentioned, it might be from either preservatives and eye drops or chronic exposure to mercury vapor in industry. It affects the eye. So start with the eyelids. Start systemically. It causes lid tremors, and this is very characteristic in chronic mercury exposure and ocular mercury toxicity. It causes band keratopathy in the cornea, and it diffuses into the eye and causes brownish discoloration on the anterior capsule, what's called mercuria lentis. Then it goes to the retina. It causes changes in structure and function. So in structure, it reduces ganglion cell layer density, and in function, it reduces central vision, reduces retinal sensitivity, reduces contrast sensitivity, and it reduces color vision permanently, and it can cause what's called xanthopsia. Just like digitalis toxicity, it can cause xanthopsia, and again it's permanent. Now we move to